Young doctors questioned the old surgeon until he performed the impossible operation. Massachusetts General Hospital rises above the Boston skyline like a cathedral of modern medicine. 14 floors, 32 operating rooms, 3,000 employees dedicated to the singular purpose of keeping people alive. The building hums with the constant rhythm of healing, ventilators breathing, monitors beeping, surgeons cutting and suturing and fighting against the inevitable. In Operating Room 7, the morning shift is preparing for a routine cholecystectomy, gallbladder removal, laparoscopic. 90 minutes, start to finish. Dr. Sarah Chen is the attending surgeon, 38 years old. Harvard Medical School, Johns Hopkins residency. She's been at Mass General for 6 years and has performed over 2,000 procedures. Her hands are steady, her judgment sound, her reputation impeccable. Her surgical team includes Dr. Marcus Webb, a fourth-year resident with ambitions of becoming chief someday, and Dr. Priya Sharma, a second-year resident who asks too many questions but learns fast. The patient is already under anesthesia when the phone rings. Sarah strips off her gloves, annoyed at the interruption. "This better be important." The charge nurse hands her the receiver. It's Dr. Patterson, chief of surgery. Sarah takes the call. "Dr. Patterson, I'm about to scrub in." "I know. I need you to postpone." "Postpone?" The patient is prepped and under. "Wake them up. Reschedule for tomorrow. I need OR 7 for something else." Sarah's jaw tightens. What could possibly be more important than a dissecting aortic aneurysm, type A? The patient is being airlifted from Worcester right now. ETA 30 minutes. The words hit like ice water. Type A aortic dissection. The deadliest vascular emergency. Without surgery, the mortality rate is 1 to 2% per hour. Even with surgery, half the patients don't survive. "Who's the attending?" Sarah asks. "That's the problem. Dr. Reeves is in San Francisco for a conference. Dr. Kumar is already in emergency surgery, ruptured AAA. The other vascular attendings are either out of town or unavailable." "Then who?" "I've called someone in. He's on his way, but I need you to assist." "Who, Dr. Patterson?" A pause. "Dr. William Hartley." Sarah goes silent. Behind her, Marcus and Priya exchange confused glances. "Dr. Hartley retired 8 years ago," Sarah says carefully. "He's still licensed, still credentialed at this hospital, and he's the only surgeon available who's ever successfully performed this procedure. Successfully performed it once, in 1987. Once is more than anyone else we have right now." Patterson's voice hardens. "The patient is a 34-year-old mother of 2. Her name is Elena Vasquez. She has about 3 hours to live without intervention. Dr. Hartley will be there in 20 minutes. I need you to prepare the OR and assist. Is that clear?" Sarah closes her eyes. "Yes, sir." She hangs up, turns to her team. "Cancel the cholecystectomy. We're doing an emergency aortic dissection repair." Marcus stares. "Who's the attending?" "William Hartley." "The William Hartley? The one from the textbooks?" "The same." Priya frowns. "I've never heard of him." "That's because he retired before you were born." Sarah starts moving, barking orders. "Get me the vascular tray. Call perfusion. I want a cardiac bypass team standing by. And somebody find me everything we have on type A dissection repairs." The room erupts into controlled chaos. 20 minutes, a patient dying in the air. And their only hope is a surgeon who hasn't held a scalpel in 8 years. William Hartley arrives at 7:47 a.m. He walks through the surgical suite entrance like a man who knows every inch of this building, because he does. He spent 43 years here, trained generations of surgeons, pioneered techniques that are now standard practice. And then he left, quietly, without fanfare. 8 years ago, he simply stopped coming in. He's 76 years old now. White hair, thin but neatly combed. Wire-rimmed glasses. He moves slowly but deliberately, the careful gait of someone whose body has accumulated decades of standing at operating tables. His hands are what Sarah notices first. They're steady. Despite his age, despite the years away, they don't tremble. Long fingers, well-maintained nails. The hands of a man who has never stopped thinking of himself as a surgeon, even if he stopped practicing. Dr. Hartley. Sarah meets him outside the scrub room. "I'm Dr. Chen. I'll be assisting today." "I know who you are." His voice is quiet, measured. I read your paper on minimally invasive valve repair. Impressive work. Thank you, sir. The patient, Elena Vasquez, 34, type A dissection originating at the ascending aorta, extending to the arch. Presented with sudden onset chest pain and syncope. CT shows a large intimal tear with blood in the pericardial space. Sarah blinks. How do you know all that? Dr. Patterson briefed me on the phone. I've been reviewing the imaging on my tablet during the drive. He holds up an iPad. The latest model, not the relic Sarah might have expected. The tear is approximately 4 centimeters. She's going to need a full ascending replacement with arch reconstruction. That's a 10-hour surgery. It's as long as it takes. Hartley moves toward the scrub room. What's our team? Myself, Dr. Webb, 4th-year resident, and Dr. Sharma, 2nd year. Anesthesia is Dr. Kowalczyk. Perfusionist is Mike Chen, no relation to me. Good, let's scrub. They enter the scrub room. The ritual begins: water, soap, brush, the methodical cleaning that every surgeon performs before entering the sacred space of the operating room. Marcus and Priya are already there, scrubbing at adjacent sinks. They stare at Hartley with barely concealed skepticism. Dr. Hartley, Marcus says, I don't mean any disrespect, but when was the last time you performed surgery? Hartley doesn't look up from his hands. 8 years ago, coronary bypass, triple vessel disease. And before that, an aortic dissection? 1987. Dr. Patterson mentioned it, I assume. That was 37 years ago, sir. I'm aware of the math, Dr. Webb. It's just, surgical techniques have evolved significantly since then. The tools, the approaches, the protocols, the anatomy hasn't changed. Hartley rinses his hands, reaches for a sterile towel. The aorta is still in the same place. The principles of vascular repair are still the same. Cut out the damaged section, replace it with a graft, restore blood flow. But the precision required, the margin for error, is the same as it's always been. Hartley finally looks at Marcus. His eyes are sharp, clear, utterly unintimidating, and utterly confident. You're worried I'm too old, too slow, too out of practice. Those are reasonable concerns. I didn't say, you didn't have to. Hartley dries his hands. Here's what I know, Dr. Webb. I've performed over 400 open heart surgeries in my career. I've repaired aortic aneurysms, replaced valves, transplanted hearts. I've lost patients on the table, and I've saved patients that everyone else had given up on. He moves toward the OR doors. I'm not here because I want to be. I'm here because a woman is dying, and I'm the only one who can help her. So you can question my abilities all you want after the surgery. Right now, I need you focused on keeping that woman alive. He pushes through the doors. Sarah follows. Then, after a moment's hesitation, Marcus and Priya. Elena Vasquez lies on the operating table, already anesthetized, her chest exposed and painted with antiseptic. She looks young, too young for this. Her face is peaceful. The anesthesia has taken away her terror, but her body tells a different story. The monitors show the chaos inside. Blood pressure fluctuating wildly, heart rhythm irregular, the shadow of death pressing in from all sides. Hartley approaches the table, studies the patient, studies the monitors. Then he does something unexpected. He takes her hand. Mrs. Vasquez, he says softly, I know you can't hear me, but I want you to know that everyone in this room is going to fight for you. We're going to bring you back to your children. The OR is silent. The nurses exchange glances. This isn't standard protocol. Hartley releases her hand, steps back, looks at his team. Dr. Chen, you'll be first assist. Dr. Webb, second assist. Dr. Sharma, I want you managing suction and exposure. Everyone clear on their roles? Nods all around. Anesthesia? Dr. Kowalczyk gives a thumbs up. She's stable for now, won't stay that way long. Then let's begin. Hartley extends his hand. Scalpel. The nurse places it in his palm. And William Hartley, 76 years old, 8 years retired, begins to cut. The first incision is textbook. A vertical line down the sternum, clean, precise. The kind of cut Sarah has seen 1,000 times. But there's something different about how Hartley does it. A confidence that goes beyond technique, like he's greeting an old friend. Sternal saw, Hartley says. The nurse hands it over. The oscillating blade winds to life. Hartley cuts through the breastbone with practiced efficiency. No hesitation, no wasted movement. The sternum splits, revealing the pericardium beneath. and the dark, ominous bulge of the aortic aneurysm pressing against it. That's the dissection, Sarah says, pointing. You can see the false lumen there. I see it. Hartley studies the anatomy. The tear is higher than the imaging suggested. We're going to need full circulatory arrest to repair the arch. Marcus shifts uncomfortably. Full circulatory arrest? That's dangerous, yes. It means stopping her heart completely while we work on the arch, cooling her body to protect the brain. Hartley glances at him. Is there a problem? It's just the mortality rate for that procedure is, without it, she dies. With it, she has a chance. Those are our options. Hartley returns his attention to the patient. Cardiopulmonary bypass, please. Let's cool her down. The perfusionist begins the process. Blood flows from Elena's body through the heart-lung machine, where it's oxygenated and cooled before returning. Her core temperature begins to drop. 37 degrees, 35, 32. 28 degrees, Mike Chen announces. We can arrest whenever you're ready. Hartley nods, but he doesn't rush. He's studying the anatomy, planning his approach. His hands rest on the surgical drapes, motionless. Dr. Hartley, Sarah prompts. I'm thinking. Marcus mutters under his breath. Too quiet for Hartley to hear, but loud enough for Priya. Great, he's thinking. Hartley's head turns slightly. Something to add, Dr. Webb? Marcus flushes. No, sir. If you have concerns, voice them. This isn't a democracy, but I don't operate with surgeons who are afraid to speak. It's just... Marcus hesitates. In my training, we've learned specific approaches for this kind of dissection. Sequential techniques. There are protocols. Protocols are guidelines, not scripture. Hartley looks at him. What do your protocols say about a dissection this extensive, with a tear at the arch in a patient with congenital abnormalities in her aortic structure? Congenital abnormalities? Hartley gestures at the exposed aorta. Look, the arch is shaped differently than standard anatomy. See how the brachiocephalic artery branches? It's more acute than normal. Textbook approaches won't work here. Sarah leans in, studies the anatomy. He's right. She hadn't noticed it until he pointed it out. How do you know that's congenital and not a result of the dissection? The tissue margins. Dissection damage looks different than developmental variation. I've seen this pattern twice before. Both times, it required a modified reconstruction approach. What approach? Hartley pauses. One I developed in 1982. The room is silent. Is it published? Marcus asks. No, it never made it past case studies. The circumstances were too rare. Hartley picks up a surgical instrument. But it works. I'm going to show you. He begins to operate. For the next 3 hours, William Hartley performs surgery like a man possessed. His movements are slow compared to younger surgeons. Age has taken some of his speed, but they're precise in a way that transcends velocity. Every cut exactly where it needs to be. Every suture placed with millimeter accuracy. He talks as he works, teaching even now. The key to aortic repair isn't strength, it's gentleness. The tissue is compromised. If you force it, it tears. You have to coax it. He demonstrates, manipulating the damaged aortic wall with instruments that seem like extensions of his hands. Dr. Chen, do you see this? Sarah leans in. The adventitia is separated from the media. The layers are delaminating. Exactly. In a normal dissection repair, you'd resect and graft. But with her anatomy, that approach would leave weak points at both anastomoses. We need to reinforce the native tissue before we connect the graft. How? Hartley produces a technique Sarah has never seen, a folding pattern that uses the patient's own tissue to strengthen the connection points. It's elegant, unconventional, and it's working. Marcus watches with growing respect. Whatever doubts he had are fading as he sees Hartley navigate anatomy that would challenge surgeons half his age. Where did you learn this? Marcus asks. I didn't learn it, I invented it. Hartley ties off a suture. 1982, a patient named Robert Chen, same congenital variation. The standard approach failed twice. He nearly bled out on the table. I had to improvise. What happened to him? He lived another 34 years, died in 2016 of kidney failure, sent me a Christmas card every year until the end. The room absorbs this, a patient from 42 years ago, still sending Christmas cards. That's the thing about surgery, Hartley says. It's not just about the moment. It's about all the moments that come after. Every patient who walks out of this room has a life waiting for them. Children, grandchildren, years they wouldn't have had. He pauses, looks at Elena's face, peaceful under anesthesia. 2 little girls are waiting for their mother to come home. That's what we're fighting for. At the 4-hour mark, things start to go wrong. The dissection is worse than the imaging showed. As Hartley resects the damaged section, he discovers that the tear extends further than expected, into the aortic root, threatening the coronary arteries. "We've got a problem," Sarah says, pointing. "The right coronary ostium is involved. If we resect here, we'll compromise blood flow to the heart muscle." Hartley studies the damage. His face is calm, but Sarah can see the calculation happening behind his eyes. "We need to reimplant the coronary arteries," he says finally. "That adds 2 hours to the surgery, minimum." "Then we add 2 hours. Sir, she's been on bypass for 4 hours already. The longer we go, the higher the risk of—" "I know the risks, Dr. Chen." Hartley's voice is sharp, then it softens. "I know them better than anyone. I've lost patients to extended bypass. I've watched kidneys fail and brains swell and hearts refuse to restart." He looks at her. "But I've also watched patients survive surgeries that everyone said were impossible because someone decided to keep fighting instead of giving up." He turns back to the patient. "We're going to reimplant the coronaries. We're going to complete the arch reconstruction. And we're going to bring this woman back to her family." He extends his hand. "4-neuroproline." The surgery continues, 6 hours in. Hartley's modified reconstruction of the aortic arch is complete. The graft is in place, the connection secure. But now comes the delicate work of reimplanting the coronary arteries. His hands haven't trembled once, but Sarah notices something else, a slight slowness that wasn't there at the beginning. A pause between movements that's half a second longer than it should be. He's tired, exhausted probably, but he won't stop. "Dr. Hartley," she says quietly, "do you need a break?" "I need to finish. We could pause, let you rest for—" "No." His voice is firm. "Once we start the reimplantation, we can't stop. The tissue won't tolerate it." He's right. She knows he's right, but she also knows what fatigue does to surgeons, the errors it causes, the lives it costs. "Then let me take over for this section," she offers. "You can guide me." Hartley stops, looks at her. For a moment, Sarah thinks he's going to refuse. Pride, stubbornness, the ego that comes with 4 decades of being the best. But then something shifts in his expression. A recognition, an acceptance. "You've done coronary reimplantation before?" "Twice, both times successfully." "Show me your hands." Sarah holds them up, steady, strong. Hartley nods slowly. "The right coronary first. The technique is similar to what you've done, but the tissue is more fragile, smaller bites, closer spacing." "I understand. I'll guide you through it, but the hands will be yours." They switch positions. Sarah takes the lead. Hartley stands beside her, watching every movement. "Good," he says as she begins. "Exactly like that. Now, angle slightly more to the left. There. Perfect." It's a strange dance. The old master and the new, his experience guiding her hands, her strength and precision executing his vision. Marcus watches, fascinated. This isn't how surgery usually works. Attendings don't share control, they command. But Hartley understands something the younger doctors don't yet appreciate. Surgery isn't about the surgeon, it's about the patient, and whatever it takes to save them is what you do. "Excellent," Hartley says as Sarah completes the first anastomosis. The tissue is holding, now the left coronary. Same approach, but watch for the variation in the ostium. Sarah works, Hartley guides. Together, they reimplant both coronary arteries. When the last suture is tied, Hartley lets out a breath he seems to have been holding for hours. Now we warm her up, and we pray. Ace to 3. The cost, 14,23 euro. The rewarming process is slow. Elena's body temperature rises gradually, 28 degrees, 30, 32. The heart-lung machine continues its rhythmic work, oxygenating her blood, keeping her organs alive while her heart rests. At 34 degrees, Hartley orders the bypass reduced. Elena's heart needs to start working again, needs to take over from the machine that's been doing its job for 7 hours. The monitor shows the first flicker of cardiac activity. Disorganized, chaotic. "V-fib," Sarah calls out. "Paddles, Hartley says. The defibrillator charges. Hartley places the internal paddles directly on Elena's heart. Clear! Shock. The heart quivers, then settles into nothing. Flatline. Again, charge to 20. Clear! Shock. Still nothing. Epinephrine, 1 milligram, Hartley orders, and charge to 30. The drug is administered. The defibrillator whines. Clear! Shock. For one eternal moment, the monitor shows a flat line. Sarah feels her own heart stop. Then, a blip. Another. A rhythm emerges, weak at first, then stronger. Sinus rhythm. The heart is beating on its own. We've got her back, Dr. Kowalczyk announces. The tension in the room releases like a held breath, but Hartley doesn't celebrate. He's watching the monitors, watching the heart, watching for any sign that it might fail again. Keep the bypass on standby. We're not out of the woods yet. For the next hour, they wait. Elena's heart continues to beat. Her blood pressure stabilizes. The grafts hold. The reimplanted coronaries are perfusing properly. Only then does Hartley step back. Begin closing, he says. Marcus moves forward, taking over for the final phase. Wiring the sternum, closing the soft tissue, skin sutures. Hartley watches him work, nods occasionally, offers a correction once when the wire tension isn't quite right. Good, he says when Marcus finishes. Clean work. Marcus looks up. There's something in his face that wasn't there 10 hours ago. Respect, certainly, but something more. Gratitude. Thank you, sir, for letting me be part of this. You didn't just observe, you assisted on a procedure that will define your career. Hartley looks at all of them. Sarah, Marcus, Priya. Every one of you will remember this day, not because of what I did, but because of what you learned. What did we learn? Priya asks. Hartley considers the question. That medicine isn't about protocols and algorithms. It's about adaptation, about seeing the patient in front of you, not the patient in the textbook, about trusting your training and then being willing to go beyond it when training isn't enough. He begins removing his gloves. The ritual of de-scrubbing, returning from the sacred space of surgery to the mundane world outside. Elena Vasquez will wake up tomorrow. She'll see her children again. She'll watch them grow up. He pauses. That's not because I'm some kind of genius. It's because everyone in this room worked together, trusted each other, refused to give up. He drops his gloves in the waste bin. That's what surgery is. Not a single surgeon performing miracles. A team refusing to let the impossible stay impossible. In the recovery room, Elena begins to wake. The anesthesia fades slowly. Consciousness returns in fragments. Light, sound, sensation. The fog of drugs lifting like morning mist. Her husband is there. Carlos. He's been waiting for 10 hours, pacing the family waiting room, praying to every saint he can name. When the nurse tells him she's waking up, he runs. Actually runs through the hospital corridors until security stops him and walks him the rest of the way. He finds her in the ICU, tubes and wires everywhere, monitors beeping their steady reassurance. Her eyes are open, barely, and she's trying to focus. Elena, baby, I'm here. Her hand twitches, searching for him. He takes it. The girls? Her voice is a whisper, rough from the intubation. They're with your mother. They're fine. They can't wait to see you. What happened? Your heart. They fixed it. Carlos is crying now, tears streaming down his face. They fixed you. Elena closes her eyes, a small smile on her lips. I dreamed someone was holding my hand before everything went dark. Someone promised to bring me back. Carlos doesn't know what to say. Doesn't know about the old surgeon who spoke to his wife before cutting her open. You're here now, he says. That's all that matters. Hartley sits in the surgeon's lounge, alone. The room is empty. The other doctors are busy with their own cases, their own crises. The coffee is cold. The chairs are uncomfortable. The fluorescent lights buzz with indifferent efficiency. He looks at his hands. They're shaking now. The tremor he's been hiding all day finally released. The exhaustion he wouldn't let himself feel. 10 hours of surgery at 76 years old. 8 years away from the table. His body is screaming. His back aches. His legs feel like water. His head pounds with a fatigue that goes beyond physical. But she's alive. Elena Vasquez is alive. He closes his eyes, lets himself feel it, the weight of what he just did, the responsibility, the terror that he'd been suppressing for 10 hours while he cut and sutured and fought against death itself. The door opens, Sarah Chen enters. She stops when she sees him, sees the tremor in his hands, the exhaustion in his face. Dr. Hartley, Dr. Chen. He doesn't try to hide his hands. There's no point anymore. Are you all right? I will be, once I remember how to breathe normally. Sarah sits down across from him. That was the most remarkable surgery I've ever witnessed. It was the most remarkable surgery I've ever performed. He almost smiles. And I've performed a few. Can I ask you something? Of course. Why did you retire 8 years ago? You were at the top of your field. You could have continued for years. Hartley is quiet for a long moment. Do you know what happened in my last surgery? The triple bypass. I read about it. Successful outcome. Successful, yes, but during the procedure, I had a moment. He looks at his hands. My hand slipped, just for an instant. I nicked the posterior descending artery. It was minor. I repaired it immediately, but it shouldn't have happened. Surgeons make minor errors all the time. It's part of the human element. Not me, not in 40 years. His voice is quiet but firm. I knew in that moment that I was losing the edge, the precision that had defined my career, and I made a decision. I would stop before I hurt someone. So you retired. I walked away, cold turkey, no farewell surgery, no gradual reduction, just done. He exhales slowly. It was the hardest thing I've ever done, and the right thing. Then why did you come back today? Hartley looks at her. Because a woman was dying. Because I was the only one who could help. Because sometimes the right thing changes based on circumstances. He stands slowly. His body protests, but he ignores it. I'm not going to make a habit of this. Today was an exception. Tomorrow, I'll go back to my retirement, my books, my garden, my grandchildren. But you proved you still have it, the skill, the judgment. I proved I can still function in a crisis. That's not the same as being fit for regular practice. He meets her eyes. You're going to be one of the great surgeons of your generation, Dr. Chen. I saw it today. The way you adapted, the way you took over when I needed you to. Don't let my example make you think you can hold on forever. I don't understand. The hardest part of surgery isn't learning how to operate. It's learning when to stop. He moves toward the door. Remember that. When the time comes, and it will come, have the courage to walk away. He pauses at the door. And Dr. Chen, thank you for trusting me, for being willing to learn from an old man who should have stayed retired. Thank you for coming when we needed you. Hartley nods. Then he's gone. 3 weeks later, Elena Vasquez goes home. Her recovery is remarkable, faster than anyone expected. The repair holds. Her heart functions normally. The grafts are integrating perfectly. On her discharge day, she asks to meet the surgeon who saved her life. He's not on staff anymore, Sarah explains. He came out of retirement just for your surgery. Can you give him a message for me? Of course. Elena hands her a card, hand-drawn, clearly made by children, 2 stick figures with big smiles. Mama's heart heroes, the crayon letters say. My daughters made it. They want him to know they're grateful. Sarah takes the card, promises to deliver it. Hartley's home is a modest colonial in Newton, 20 minutes from the hospital he spent 4 decades in. The garden is what he loves most now, roses and tomatoes, and a small herb section that his wife uses for cooking, physical work that keeps his hands busy without requiring the precision they can no longer guarantee. Sarah finds him there, on her day off, kneeling in the dirt with a trowel. Dr. Chen, he doesn't seem surprised to see her. Come to check on your patient? I came to deliver something. She hands him the card. Hartley opens it, studies the childish drawings, the careful lettering. His face softens in a way Sarah hasn't seen before. Mama's heart heroes, he reads aloud. Her daughters made it. They wanted you to know. Hartley is quiet for a long moment. Then he stands, slowly, carefully, and gestures toward the porch. Would you like some tea? They sit on weathered Adirondack chairs, cups of Earl Grey warming their hands. The autumn air is crisp, carrying the smell of fallen leaves and wood smoke from somewhere down the street. How is she? Hartley asks. Better than we could have hoped. Full recovery expected. She'll be back to normal life within 6 months. Normal life? He savors the words. Do you know what I love most about surgery? What? The arithmetic. You go in with a patient who has a certain number of days left, maybe hours, maybe none. You come out and that number has changed. You've added time, years sometimes, decades. He looks at the card again. Elena Vasquez might live another 50 years. She'll see her daughters graduate, get married, have children of their own. 50 years of moments that wouldn't exist without what we did in that operating room. That's why you came back when Dr. Patterson called. Partly. Hartley sets down his tea. But I also came back because I needed to know. Know what? Whether I still could. His voice is honest, without vanity. 8 years away. A body that doesn't work like it used to. A mind that forgets things sometimes. I needed to know if the surgeon I used to be was still in there somewhere. And is he? Hartley considers the question. He's there, older, slower, but still there. He pauses. The question is whether that's a good thing or a dangerous thing. You saved her life. This time. But what about next time? Or the time after that? He shakes his head. That's why I can't go back. One successful surgery doesn't erase the reasons I retired. It just proves that in extreme circumstances, I can still function. That's more than most people can say at any age. Perhaps, but most people don't have lives in their hands. A cardinal lands on the garden fence, bright red against the autumn browns. Hartley watches it for a moment before continuing. After today, I'm going to do something I should have done years ago. I'm going to start teaching again, not surgery. I can't teach what I can no longer safely do, but the things that matter more. Judgment, decision-making, how to see the patient, not just the pathology. Where? Harvard offered me an emeritus position years ago. I turned it down, too proud to accept what felt like a consolation prize. But I called them last week. They're still interested. Sarah smiles. The residents are going to love you. They're going to think I'm a dinosaur, which I am. He returns the smile. But maybe dinosaurs have something to teach the mammals. 6 months later, William Hartley stands at a podium in the Tosteson Medical Education Center. The lecture hall is packed. 200 medical students, residents, and fellows. Word has spread about the old surgeon who came out of retirement to perform an impossible operation. Good morning, Hartley says. I'm Dr. William Hartley. Some of you may have heard of me. Most of you probably haven't. That's appropriate. Medicine isn't about individual fame. It's about collective progress. He clicks to the first slide. A photograph of an operating room from the 1970s. Ancient equipment by modern standards. Surgeons in cloth masks instead of disposables. This is where I started. Massachusetts General, 1971. I was 23 years old, terrified, convinced I was going to kill someone. The students laughed nervously. That fear never went away. In 43 years of surgery, I never lost it. And I hope I never would have, because the day you stop being afraid of the responsibility you carry is the day you become dangerous. He clicks to another slide, a chart showing mortality rates for aortic dissection repair over 5 decades. In 1971, a type A dissection was essentially a death sentence, 90% mortality. Today, with proper intervention, survival rates exceed 70%. That's not because surgeons got smarter, it's because we got humbler. We learned to work in teams, to trust technology, to admit when we didn't know something. He looks out at the audience. I want to tell you about a patient, Elena Vasquez. Last year, she presented with a type A dissection and several anatomical variations that made standard approaches impossible. Every protocol said she couldn't be saved. He clicks to a post-operative image. Elena smiling, holding her 2 daughters. She's alive today because a team of surgeons, young and old, experienced and inexperienced, worked together, adapted, refused to accept that impossible meant impossible. He pauses. I was part of that team, the oldest part. And I'll tell you a secret. I was terrified, more terrified than I'd ever been in my career, because I hadn't operated in 8 years, because my hands weren't as steady as they used to be, because I knew that if I failed, a woman would die and 2 children would grow up without a mother. The room is silent. But I also knew something else. I knew that fear isn't the enemy. Fear is the signal that tells you something matters, that you need to pay attention, that you need to bring everything you have. He clicks to a final slide, a simple quote. Courage is not the absence of fear, but the judgment that something else is more important than fear. That's what I want you to remember. Not the techniques I'm going to teach you, those will change. Not the technologies, those will evolve. But this, when you stand at that table with a life in your hands, fear is your ally. It keeps you sharp, keeps you humble, keeps you human. He steps back from the podium. That's the end of my introduction. Next week, we'll start with surgical decision-making. I expect you to have read chapters 1 through 3 of your text, and I expect you to disagree with at least some of what you read. A hand goes up. A young woman in the front row. Yes? Dr. Hartley, do you regret retiring when you did, given that you could still operate successfully? Hartley considers the question. I regret nothing. I retired when it was right to retire. I came back when it was right to come back. And now I'm teaching because that's what's right for this phase of my life. He smiles slightly. The trick isn't knowing what to do. It's knowing when to do it. That's true in surgery. That's true in life. He gathers his notes. Class dismissed. I'll see you next week. William Hartley taught at Harvard Medical School for 4 more years. His lectures became legendary. Packed houses every session, students fighting for seats. He taught judgment, decision-making, the art of seeing patients as people rather than pathologies. He never operated again, not once. He'd proven what he needed to prove, and he had the wisdom to know that proof wasn't permission. Elena Vasquez visited him once a year, always bringing her daughters. They'd grown up calling him Dr. Hart, the man who fixed their mother. He kept every card they made him, displayed in his study next to his diplomas and certifications. Sarah Chen became chief of cardiac surgery at Mass General, the youngest in the hospital's history. At her installation ceremony, she invited Hartley to speak. "Everything I know about surgery," she told the audience, "I learned from textbooks and teachers. But everything I know about being a surgeon, I learned from one man, one operation, one impossible morning when an old surgeon came out of retirement and taught us all what it means to fight for a patient's life." Hartley spoke briefly about legacy, about passing the torch, about the privilege of watching the next generation surpass the one before. Marcus Webb went on to become a renowned vascular surgeon. He developed new techniques for aortic repair, innovations built on the foundation Hartley had laid decades earlier. In every paper he published, there was an acknowledgement. With gratitude to Dr. William Hartley, who showed me that the best surgeon is the one who never stops learning. Priya Sharma became an educator herself, specializing in surgical simulation. She created training programs that allowed young surgeons to practice complex procedures in virtual environments, learning from mistakes without risking lives. She called the program Hartley's Method, though he'd never used a simulator in his life. William Hartley passed away on a Sunday morning in October, 3 years after his last lecture. He was in his garden when it happened. His wife found him kneeling among the roses, trowel still in hand, a peaceful expression on his face. The doctors said it was his heart, finally giving out after 93 years of service. His funeral was held at the church he'd attended since childhood. The pews were filled with surgeons, former students, colleagues, patients who'd survived because of his skill. Elena Vasquez was in the 3rd row, her daughters now teenagers, crying silently for the man who'd given them their mother. Sarah Chen gave the eulogy. Dr. Hartley used to say that surgery isn't about the surgeon, it's about the team, the patient, the moments that come after. Her voice was steady, but her eyes were wet. He was wrong about one thing, though. Sometimes it is about the surgeon. Sometimes one person makes all the difference. She looked at the casket draped in flowers. He taught us that fear is our ally, that humility is our strength, that the hardest part of medicine isn't knowing what to do, it's knowing when to stop. She paused. Dr. Hartley knew when to stop. He retired with grace, came back with purpose, and left when his work was done. That's not just good medicine, that's a good life. In the lobby of Massachusetts General Hospital, there's a plaque now, bronze, mounted near the entrance to the surgical wing. It shows a pair of hands, surgeon's hands steady and strong, and beneath them an inscription, in honor of Dr. William Hartley, 1947-2040, who taught us that the greatest surgery is knowing when to cut and when to heal, and who reminded us in his final operation that the impossible is just another word for not yet. Every year, on the anniversary of Elena Vasquez's surgery, the cardiac surgery department gathers at that plaque. They tell the story to new residents, the story of the old surgeon who came out of retirement, who fought through exhaustion and doubt, who saved a life everyone said couldn't be saved. They tell the story not because it's about heroism. They tell it because it's about something more important. It's about knowing that somewhere in every surgeon's hands, there's more than skill. There's legacy. There's love. There's the accumulated wisdom of everyone who came before. Every teacher, every mentor, every impossible case that became possible because someone refused to give up. William Hartley's hands are still now, but his touch lives on. In every surgeon who remembers that fear is an ally. In every patient who survives because a team refused to accept impossible. In every moment of grace when medicine becomes more than science, when it becomes, for just an instant, something like a miracle. Maybe that's what healing really means. Not just fixing what's broken, but passing on what we know, teaching the next generation, trusting them to go further than we ever could. History forgets the noise. It remembers the silence that followed. End or